safe. Don't worry, my name is Dr. Dreams. You've had a little bit of a tumble, and you have been injured. It's not life-threatening, fortunately, but I do need to examine you and see to your injuries. Alright, okay. Are you in any severe, excruciating pain at the moment? Alright, just feeling a little bit tender and achy. Alright, okay. But you are not to worry. You're in very good hands. You're safe now. So I am going to start by examining you. Let me grab my light. Since you fell, I want to check for signs of concussion. Alright. Okay, so I'm just going to look into each of your eyes to see how your pupils dilate. Good, okay. And now if you just follow my light with your eyes, please. Good. Okay. Very good. Okay. Are you feeling dizzy? And any nausea, confusion at all? Alright. Do you know your name? Oh, good. And do you know where you are? Yes, we're in your room. Someone called me. I do make house visits, so that's very good. Do you know what happened? Yeah, painting and then fell. Oh dear. Oh well. At least it's not worse, right? Okay, you do have a laceration on your head here, so I would like to tend to that, and then we can move on from there. Okay, looking at it, it does seem like it's a little deep, so I'm going to have to clean that out. I'm going to give you a shot for the pain, and then we'll be able to clean that out thoroughly. Alright. Okay, it won't hurt too much. Okay. See, that wasn't so bad. Okay, I'm going to start out by just cleaning around the wound. You can stay exactly where you are. Right, I'm just going to spray this. It might feel a little bit cool, but it shouldn't hurt now. Okay. Good. Just go on and clean that. Alright. Does that hurt? A little bit, okay. I see there's a little bit of debris in there. So I'm just going to grab my tweezers. I can find them. Okay. Just going to go in and remove. Good. Okay, just stay still. Doing excellent. Very, very good. Alright, there's just a few more pieces inside of there. Okay, looking good. Okay, I don't think it's going to need any stitches, fortunately. But I'm just going to flush it out a little. Okay. normally this is used for eyes, but it can also be used to flush out wounds. So if you will just tilt your head forward for me, please. Okay, good. Okay. Very good. Okay, let me just pat that dry. And then I'll get a band-aid. Oh, some sterile gauze first. I'm going to cut that to size. Let me just spray some antiseptic on here. Okay. Go again. Alright. Good. You are doing very well. And I will put a little bit of this tape on. Okay. Okay, just going to stick that on you. Over there. Good. Okay, and there is a small little scrape here. Okay. Fortunately, I won't need to give you a shot for that one. Okay. So, I'm going to wrap that in a bandage. Okay. So you can just lie exactly where you are. Right, all good. Good stuff. I just want to take your temperature and ensure that there is no irregularities. Don't know how to turn this on. There we go. Okay. Okay, it's in Fahrenheit, so I don't actually know if this is good or bad, but it seems fine. Alright. So that's very, very good. I do see you have a little bit of a bump on your head. So you can go ahead and just hold this to that, and then it'll help any swelling go down. Okay. Just check that bandage is nice and secure. Very good. Okay. I need to just examine you for some pain now, please. Alright, so can you just... Okay, I'm going to move your head for you, and I want you to just let me know if anything feels particularly painful or out of the ordinary. Alright. Okay, and I'm going to bring you forward. Okay, back. Left. And right. Okay. Okay. That seems to be fine. You have mobility in your neck, so that's very good. And now I want to just check your arms and your legs. Okay, so So if you'll just give me your arm, please. Right, okay. And take your arm, your hand, and bend it. Okay, and then move your arm up and down like this. Okay, good. And lift your arm. Okay, good. And move your fingers for me. Make a fist. Open up. Okay, good. And then onto the other arm. So give me your arm, please. Okay. And move your wrist like this. Open and close like this. Good. And up and down. And then fingers. Make a fist. Fingers. Okay, good. Good. I want to check your abdomen. Just make sure there are no concerns there. Alright. Okay. Does that feel uncomfortable? Do you feel anything that isn't normal? Okay, good. We wouldn't want something like a burst appendix or... Okay, and then I'm going to check your legs too, please. So we'll start with the left one. Okay, so lift it. Good. Bend. Good. Okay, and then the same with your foot. Just around with your ankle. Okay, and point and flex, point and flex. Good. You're doing well. You're doing so well. Fantastic. And there's nothing that you feel on your legs here. Good. Okay. And onto this side, we're going to lift that leg. Okay, and bend. Okay, good. And your ankle. Move your foot around. Right, and point and flex. Good, okay. I'm going to tickle the bottom of your feet to make sure that you can feel this, alright? I hope you're not too ticklish. Okay. Okay, and you can feel that? Good. Good. Alright. That's very, very good. Okay. I just want to make sure that you are comfortable. Okay. Are there any other ailments or anything that you can feel on your body that you want me to have a look at? Okay. Good. Alright. That nausea and a little bit of dizziness does make me a little bit concerned for concussion, so I just want to perform another test. Okay. Alright, so will you please tell me how many fingers I'm holding up? Okay. Now? Now? Right, good. How many now? Good. And how many fingers now? Fantastic. And on this side, how many fingers? Good. Good. Okay. Good. Do you know what date it is? What month we're in? And the year? I didn't even know it was the 19th. Is it the 19th? 20th? 18th? 17th? I don't know. We'll have to check with the nurses on that one. Just want to be doubly sure that that's correct. Okay. And I want to check inside of your eyes and your nose. Okay. Good. just open your mouth for me, please? Say ah. Good. Right. That seems good. There's no bloody nose or anything like that. I had just to test your reflexes a little bit, okay? Good. And you're feeling that? You're feeling it alright? Good. 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 Okay. And I'm just going to do the toes. Fantastic. Right. Just want to listen to your heart and your breathing. Okay, good. Take a deep breath for me, please. Good. Alright. And another deep breath. Your lungs sound very healthy, as does your heart. Okay. Very good. And again, I just want to listen to your abdomen. Okay. Good. Okay, so it does seem like you're alright. You've just had a little bit of being knocked around, but it's not too bad. I want to ensure that you are safe and comfortable, so let me just tuck you in. Okay. I have some painkillers for you. If you feel your pain is rising or getting to a level that you cannot tolerate. Okay. It's just some standard ibuprofen and one of my painted nails. You don't have to take that. If you don't want to, that one is optional. Okay. I'll leave those here for you. Right, and the call button for your nose. Somewhere here. There it is. So I have this, I know this is a house call, but I have this little call button because I'm going to be here. I will be, if you'd prefer for me to stay here in the room with you, I'm very happy to do that, but I'm going to just be around, so just depress this if you need me to come in if anything feels wrong or funny or anything like that. Okay. And I'm going to stay as long as you're okay. Make sure that you're okay, and please just make sure to take your rest. No more ladder climbing for you, at least not for a couple of weeks. Alright, be sure to drink plenty of liquids, and you're going to be okay. Yeah. Any dizziness, if there's any vomiting, throwing up, any nausea, that kind of thing, again, let me know, because if there is concussion, then we need to do a little bit more for you, but hopefully that's not the case. Okay, good. Okay, so you can rest nicely now, close your eyes and know that you're safe. Okay, you've been taken care of. I'll be here if you need